One of the higher education issues brought into sharper focus by the COVID-19 pandemic has been student mental health. We are joined by Christy Davis, Associate Dean for Student Wellness, Director of the Health and Wellness Center, and Licensed Professional Counselor at Arkansas Tech University. Christy, thank you for investing your time and expertise with us today for a conversation about student mental health. To begin, just based upon national research that has been conducted and your observations, how has the COVID-19 pandemic affected the mental health of college students?
Well, as you all may know, mental health was already a big concern amongst college students. In fact, in my years working in mental health, I've just seen more and more concerns from students. In fact, even before the pandemic, there were some studies that said 1 in 3 college students were struggling with mental health and would be showing symptoms of a mental health disorder. So it was already an issue. And now with the pandemic, it's even more of a concern. There's a group that works with college students' mental health called Active Minds, and they did a study last fall, and almost 75% of students said that their mental health had worsened since the pandemic had begun. And there's large numbers of students who are saying that they're stressed and anxious. About 87% of those students, more disappointment and sadness, feeling lonely and isolated. Of course, that makes sense with all of the social distancing. And for many of them, they say that their anxiety, their stress, their sadness, their depression had all increased since the beginning of the pandemic. So yes, it's definitely a big concern right now.
As we, kind of absorb those numbers, what are some of the indicators of a potential mental health concern that we should look for in ourselves and in those that we care about?
Yeah, I'm just going to kind of run through a list of some things to look for that you might even look for in yourself or in other people that you care about. Any behavioral or emotional changes, someone that just doesn't seem to be kind of acting like themselves might be an indicator. Withdrawing from others. A lot of times when people are struggling with mental health, they tend to start isolating. Maybe they're already an introverted person, but they're even more so, or maybe they're typically a real social person, but they're not wanting to go and hang out with people or really even interact with them in other ways. You may see changes in their appearance or their hygiene. In terms of school, you may see students that were typically a good student but are struggling to get their work done or their grades are declining. More alcohol and drug use, especially increases in that use. Excessive or inappropriate anger. As I mentioned earlier, anxiety, panic, fear, um, bizarre thoughts or behaviors. So maybe sometimes people will seem a little out of touch with reality. Maybe they're saying things that don't quite make sense, or even talking about suicide or wanting to end their lives. Anytime other people are just uncomfortable or worried about someone, sometimes you just have that gut feeling that something's not right with someone. Maybe they're not functioning well, maybe they're not attending class, or they're really having trouble sleeping or wanting to sleep all the time. Same goes for appetite. Sometimes people just don't have an appetite when they're struggling and they're maybe losing weight. It can also go to the other end of the spectrum where they're eating more, they're gaining weight, maybe binge eating, wanting to harm themselves or other people, just this sense of apathy and indifference to life, trouble concentrating, and then having low energy or maybe feeling worthless or hopeless. So, any of those things, in and of themselves, just occasionally, that's some of us could probably say that we feel that way sometimes. But if this is something that you're seeing on a regular basis for days and weeks, then I think definitely is something to look into getting help for.
We're told that the best care is always preventative care, and if we can, identify these issues early on and address them before they become larger issues, sometimes that's the best thing for our mental health. Are there any self-care techniques that we can practice to reduce stress and anxiety?
Yes, and I think that word you just used, practice, is really important. So it's something that I think we have to be intentional about. I'm going to name some things that I think are helpful, but just keep in mind that this is something that I think we have to be intentional to make time for in our lives, or we really get depleted. And I think that's when we really struggle. So practicing interacting with people. That active mind study that I mentioned, those students said that the thing that helped them the most was either virtual interaction with their friends or in person interaction with friends. And I know that's a little tricky right now. We have to do it in a safe way, but being around people is important in some way, or connecting, even if it's just by phone or through social media. Being with pets, if you have pets, I know that's a little more of a challenge on campus, but we do have our wonderful campus ambassador, Jerry, who hangs out in the student union, I hear, on Mondays and Wednesdays from 2:30 to 4:30. I'm sure he would benefit from that as well as our students. Receiving support from your families and friends at home, any way that you can detach from stress. So anything that gets you kind of in that zone that we talk about where you're not thinking about anything else. For me, that's sometimes reading. I've been reading a lot more through the pandemic, practicing yoga, mindfulness. I use an app called Insight Timer to practice meditation. That's been really good for me. Um, Something that just allows you to get out of whatever it is that's stressing you out. We're doing a workshop in the health center soon that I'll tell you more about in a minute, but we've been posting this week on our Instagram about stress management. So I encourage you to look at our Instagram account as ATU Student Wellness. And I did a story last night and asked students what they're doing to manage their stress. And there's a lot of good responses there if people want to take a look at that. Also, something I've told students for a long time, and I practice myself, is breathing techniques. Breathing is something that's always there. You can always stop wherever you're at and do some breathing. Just taking deep breaths is helpful. There's a practice called 4-4-8 breathing, where you just inhale to the count of 4, then hold your breath for the count of 4, and exhale to the count of 8. And if we take time to do that type of intentional deep breathing, that can really change the stress response in the body. And of course, exercise is really a good go-to as well.
You and your colleagues in the Counseling Center at Arkansas Tech have done such a great job in recent years diversifying your offerings, both in terms of audience and topics. What are some of the other resources that are available to Arkansas Tech students who have questions about their mental health?
Yeah, we have such a supportive campus. I think anybody that works here, I think you could go to and talk through what's going on, and they might be able to either just lend a helping hand or encourage you to use your self-care practices. We also have a care team on campus that responds to students that are in distress. So if you want to read more about that, there's a website about the care team. In the counseling center, the health and wellness center, we offer a lot of programs and workshops. In fact, we're doing an in-person stress management workshop next week, but we have many of those that are listed on our website. We offer individual counseling in the health and wellness center, as well as group counseling and couples counseling. So it's really easy to call and schedule an appointment if that's something that you feel like would be helpful. And then one other resource that we have in the Health and Wellness Center is called the Biofeedback Lab or Relaxation Room. It's just a space that you can walk in. It's really comfortable and relaxing. We have lots of tools in there, whether it's meditation cushion that you want to sit and meditate, or a beanbag chair just to sit and relax or take a nap. We have all kinds of multisensory tools that you can use to just kind of get your mind off of the things that are stressful. So you can just walk in and ask to use that space, and it's open and available anytime that we're here Monday through Friday, 8 to 5.
Well, Christy, thank you very much for sharing this important information with our audience on arkansastechnews.com. Arkansas Tech students, please remember there is help available if you're feeling anxious, overwhelmed, or discouraged. The phone number is 479-968-0329, and the web address is atu.edu/HWC. Thank you very much for watching.
Thank you.